Elderly people. 3 types of seeds you should absolutely not eat. 3 types of golden seeds that are good for health in old age. Are you over 60? Listen up, because what you're about to hear could be a game changer for your health. We all love a good snack, and nuts are often hailed as a superfood. But hold on, are all nuts created equal when it comes to our golden years? The shocking truth is, no. There are certain nuts, perhaps even some you're eating right now, that could be silently sabotaging your health, leading to serious problems down the line. But don't worry, because today, we're not just exposing the culprits. We're also revealing the 3 nut superstars that every senior should be adding to their diet for a vibrant, healthier life. Stay tuned. This is information you absolutely cannot afford to miss. Nuts, in general, are a valuable source of nutrition, rich in healthy fats, protein, fiber, vitamins, and minerals. However, for older adults, the selection and consumption of nuts require careful consideration. To maximize benefits and avoid unnecessary risks, 3 types of nuts older adults should be extremely cautious with or avoid, and detailed harms. It's important to note that it's not the nut itself that is entirely toxic, but rather the processing method, consumption quantity, or storage conditions. They're the main factors making them unsuitable or potentially risky for seniors. Overly salty or heavily seasoned nuts. Harmful substances / main harmful components. Excess sodium, from table salt, NaCl, monosodium glutamate, MSG. Some individuals are sensitive. Other additives, flavor enhancers, preservatives, and seasonings. Specific harms to the body, especially in older adults. Cardiovascular system. Increased blood pressure. Older adults' kidneys may be less efficient at excreting excess sodium, leading to water retention, increased blood volume, and elevated blood pressure. This puts significant strain on the heart and blood vessels. Heart disease. Chronic high blood pressure is a major risk factor for heart attacks, strokes, and heart failure, which are common and dangerous conditions in the elderly. Kidneys. Decreased kidney function. The kidneys have to work harder to remove excess sodium. Over time, this can impair kidney function, which may already be weakened by age. Musculoskeletal system. Calcium loss, osteoporosis. High sodium intake can increase calcium excretion in urine, potentially worsening osteoporosis. General body. Edema, water retention causes swelling in the legs, ankles, and hands, leading to discomfort and limited mobility. MSG sensitivity reactions. In some individuals can cause headaches, nausea, dizziness, and a flushing sensation. Advice: opt for natural, unsalted, or lightly salted nuts. If you want to enhance flavor, you can roast them yourself with a few natural herbs. Sugar-coated, honey-coated, or candied nuts. Harmful substances / main harmful components. Added sugars, sucrose, high fructose corn syrup, HFCS. Commercial honey, often with added sugar. Specific harms to the body, especially in older adults. Metabolism and endocrine system. Blood sugar spikes, very dangerous for seniors with diabetes or prediabetes. Sudden rises and falls in blood sugar cause fatigue and dizziness. Risk of type 2 diabetes. Chronic high sugar consumption contributes to insulin resistance. Weight gain, obesity. Excess sugar is stored as fat, increasing the risk of obesity-related diseases like heart disease and arthritis. Liver. Non-alcoholic fatty liver disease. In AFLD, excess sugar can be converted into fat that accumulates in the liver. Oral health. Cavities, gum disease. Sugar feeds harmful bacteria in the mouth, a particular problem for seniors who may already have dental issues or dentures. General body. Chronic inflammation. A high-sugar diet promotes inflammation in the body, linked to many age-related diseases. Brain. Cognitive decline. Some studies suggest a link between high-sugar diets and an increased risk of cognitive decline and dementia. Advice: avoid nuts prepared this way. Enjoy the natural sweetness of some unsweetened dried fruits, along with natural nuts if you crave sweetness. Moldy, rancid, oily smelling, or improperly stored nuts. Pay special attention to peanuts and cashews. Harmful substances / main harmful components. Aflatoxin, a mycotoxin produced by molds like Aspergillus flavus and Aspergillus parasiticus, commonly found on peanuts, cashews, and corn. Other mycotoxins. Other mold toxins may also be present. Oxidized fats, rancidity when fats in nuts spoil due to exposure to air, light, or heat. Specific harms to the body, especially in older adults, due to aflatoxin and other mycotoxins. Liver. Acute and chronic liver damage. Aflatoxin is extremely toxic to the liver. Liver cancer. Aflatoxin is one of the most potent natural liver carcinogens. Seniors with reduced liver function are even more susceptible. Chronic exposure, even at low levels, increases the risk. Immune system. Immune suppression weakens the immune system, making older adults more susceptible to infections. Acute poisoning, rare with low exposure, but can occur if nuts are heavily contaminated with mold. Symptoms include vomiting, abdominal pain, convulsions, edema, and even death. Due to rancid fats. Digestive system. Digestive upset. Causes nausea, diarrhea, and stomach discomfort. General body. Cellular damage. Oxidized fats create free radicals, which damage cells, contributing to chronic diseases and the aging process. Inflammation. Can promote inflammation in the body. Nutrition. Reduced nutrient absorption. Rancid fats can interfere with the absorption of fat-soluble vitamins A, D, E, K. Unpleasant taste and smell. Makes food unpalatable and can lead to loss of appetite. Advice. Buy nuts from reputable sources with clear packaging and check expiration dates carefully. Store nuts in a cool, dry place in an airtight container. Some nuts can be stored in the refrigerator, cool compartment, to extend their shelf life, but ensure they are tightly sealed to prevent moisture absorption or odor contamination. Absolutely do not eat nuts that show signs of mold, discoloration, have a strange smell, or an unusually bitter taste. 3 types of nuts older adults should prioritize eating. These nuts are highly valued for their nutritional content and health benefits, making them particularly suitable for older adults. Incorporating them reasonably into the diet can bring many positive impacts. Walnuts. Specific effects and preventable diseases. Superior cardiovascular protection. Alpha-linolenic acid, ELA, a plant-based omega-3 abundant in walnuts, significantly helps reduce LDL, bad cholesterol, triglycerides, and blood pressure. This helps prevent atherosclerosis and reduces the risk of heart attack and stroke. Polyphenol in walnuts also improve endothelial function, making blood vessels more flexible. Supports brain and nerve function. Omega-3s and antioxidants like vitamin E, melatonin, and ellagic acid in walnuts play a crucial role in protecting brain cells from oxidative stress and inflammation. Regular walnut consumption can help improve memory, concentration, information processing speed, and slow the progression of age-related neurodegenerative diseases like Alzheimer's. Potent anti-inflammatory properties. Natural anti-inflammatory compounds in walnuts help reduce markers of chronic inflammation in the body, a risk factor for many age-related diseases such as arthritis, heart disease, and some types of cancer. Supports blood sugar control. Although more research is needed, some evidence suggests walnuts may improve insulin sensitivity and help control blood sugar in individuals at risk for or with type 2 diabetes. Improves gut health. The fiber and compounds in walnuts can promote the growth of beneficial gut bacteria, contributing to a healthy digestive system. Reasonable usage for older adults. Serving size, about 5 to 7 walnuts per day, equivalent to 28-30 g. How to use. Eat directly as a healthy snack. Chop and add to salads, unsweetened yogurt, or oatmeal. Blend into smoothies. If chewing is difficult, walnuts can be soaked in warm water for 15 to 30 minutes to soften them, or use cold-pressed walnut oil in moderation. Note, due to their high calorie and fat content, balance with total daily calorie intake. Almonds. Specific effects and preventable diseases. Optimal bone health maintenance. Almonds are a rich source of calcium, magnesium, phosphorus, and vitamin E. Calcium and phosphorus are main components of bones, while magnesium helps the body absorb and utilize calcium effectively. Vitamin E acts as an antioxidant, protecting bone cells. This is crucial for preventing and slowing osteoporosis and reducing the risk of fractures in older adults. Effective cardiovascular protection. Monounsaturated fats, vitamin E, magnesium, and fiber in almonds all contribute to lowering LDL, bad cholesterol, increasing HDL, good cholesterol, stabilizing blood pressure, and reducing inflammation, thereby lowering the risk of coronary heart disease and stroke. Supports blood sugar control and diabetes prevention. The fiber, magnesium, and healthy fats in almonds help slow sugar absorption and improve insulin sensitivity, which is very beneficial for older adults at risk for or managing type 2 diabetes. Enhances skin and eye health. Vitamin E is a powerful antioxidant that helps protect the skin from free radical damage and slows aging. Almonds also contain riboflavin, vitamin B2, which is good for the eyes. Improves digestive function. The abundant fiber content promotes regular bowel movements and prevents constipation, a common problem in older adults. Reasonable usage for older adults. Serving size. About a small handful, 20 to 25 nuts, equivalent to 28-30 g per day. How to use. Eat raw, soaked, or unsoaked. Soaking almonds overnight can make them softer, easier to digest, and increase the bioavailability of some nutrients. Add to breakfast cereals, salads, or yogurt. Use almond flour in baking or cooking. Drink unsweetened almond milk. Note: choose natural, unsalted, and unsweetened almonds. Individuals with swallowing difficulties should be cautious or choose processed forms. Sliced flour. Pistachios. Specific effects and preventable diseases. Eye health protection. Pistachios are very rich in lutein and zeaxanthin, two carotenoids concentrated in the eye's retina. They act as natural sunglasses, helping to filter harmful blue light and protect the eyes from free radical damage, thereby reducing the risk of age-related macular degeneration, AMD, and cataracts, leading causes of vision loss in older adults. Comprehensive cardiovascular health support. Pistachios contain monounsaturated fats, fiber, potassium, and antioxidants like gamma-tocopherol, a form of vitamin E, that help lower LDL cholesterol, improve blood vessel function, stabilize blood pressure, and reduce inflammation, contributing to heart disease prevention. Weight and blood sugar management. With high protein and fiber content, pistachios help promote satiety, limiting unhealthy snacking. They also have a low glycemic index, GI, and can help improve post-meal blood sugar control. Boosts immune system. Vitamins and minerals like vitamin B6, zinc, and selenium found in pistachios play an important role in maintaining healthy immune function. Improves gut health. The fiber in pistachios serves as food for beneficial bacteria, helping to balance the gut microbiome. Reasonable usage for older adults. Serving size. About 30 to 40 nuts, in shell, equivalent to 28-30 g of kernels per day. How to use. Eat directly as a snack. Shelling each nut also helps to eat slower and better control portions. Add to salads, desserts, or main dishes. Grind and sprinkle on yogurt or oatmeal. Note: prioritize unsalted or lightly salted varieties. If buying in shell, pay attention to shell quality, avoiding nuts that are excessively cracked or show signs of moisture or mold. General advice for older adults when eating nuts. Portion control. Although good, nuts are generally high in calories. Older adults should eat them in moderation, about a small handful per day, equivalent to 25-30 g, is sufficient. Choose natural, minimally processed types. Prioritize raw nuts or those naturally roasted without salt, sugar, or seasonings. Chew thoroughly or process appropriately. If older adults have dental problems or difficulty swallowing, nuts can be ground in a powder to add to yogurt, smoothies, porridge, or made into nut butter. Soaking some nuts, like almonds, walnuts, before eating can also make them softer and easier to digest. Drink enough water. The fiber in nuts needs water to work best for the digestive system and help prevent constipation. Listen to your body. If you experience indigestion, bloating, or any adverse reactions after eating a specific type of nut, reduce the amount or stop using it and consult a doctor. Some older adults may be sensitive to certain nuts. Diversify. Don't just eat one type of nut. Incorporate a variety of nuts into your daily or weekly diet to receive a diverse range of nutrients and maximize health benefits. Be mindful of drug interactions. Although rare, some components in nuts may interact with medications. If you're taking medication for chronic conditions, discuss adding nuts to your diet with your doctor. Important: the information above is for reference only. Each individual has unique health conditions and nutritional needs. Older adults, especially those with underlying medical conditions, should consult their doctor or a dietitian before making changes to their diet or regularly supplementing with any food. Wishing you and your family good health. If you found this information helpful, please consider liking this video and subscribing to our channel for more health tips for seniors. Your support helps us create more valuable content.